Good morning and welcome back at 6:23. So how do we know when our feelings of sadness are more than just a bout of the blues? Joining us this morning to help explain some simple tips is Dr. Kristina Kennedy, a psychiatrist with Baptist Health Behavioral Health Clinic in North Little Rock. Good morning to you.
Hi.
So Dr. Kennedy, how do we know when feelings of sadness are something more?
Yeah, so everybody has days where they feel sad or has down days, and that's totally normal. But if you're feeling like you're having trouble getting through the day or you're having more symptoms of depression, then and I think we can go over some of those symptoms today, then you might need to consider that you might be suffering from depression and may need to get some help for that.
So you just talked about it. What are the symptoms that we need to be watching for, when it comes to depression?
A lot of people think that being depressed is just being sad, but you're also going to have symptoms like changes in your sleep, changes in your appetite, trouble concentrating. It might be hard to feel motivated, difficult to get through the day. It feels like everything is just a barrier. It's just, you have to get over that hurdle for every single thing. You might also just not enjoy the things that you used to enjoy doing. And then sometimes a more severe symptom would be that you could feel suicidal, or you could feel like life's just not worth living anymore.
So if someone is watching and they heard those symptoms and they're like, hey, that really describes me, what should they do?
Well, there's some lifestyle changes you can make in terms of always eating healthy and exercising is good, but that's just not enough for some people. And I really think the first thing that somebody should do is talk to their doctor, just their primary care doctor even, and they're usually able to manage it or refer you to a psychiatrist if needed.
So maybe you touched on this. Again, when is it time for people to seek professional help?
Yeah, so if you're feeling like you're having some of those symptoms that I listed more days than you're not, or that you're having trouble getting through the things that you need to do on a normal day, or if you are having thoughts of suicide, then that's a good time to reach out.
So, doctor, would you speak against people who like to maybe eat something sweet when they're feeling down?
No, not at
Okay.
all. I think having healthy lifestyle can help you feel better, and that's absolutely true, but there's nothing necessarily wrong with having a sweet treat every now and then. I certainly love a sweet treat. And that's
or maybe doing a little shopping?
Doing a little shopping. There's other ways to make yourself feel good. That might not get you out of feeling depressed, but it doesn't hurt you necessarily.
And we talked about this earlier. The Suicide and Crisis Hotline is 988. It's available 24/7, and it's there for anyone who might need it.
Yes, so it used to be this really long number, which was hard to remember. It's now just 988, and you can text it or call it. I think you can even just go online and chat with it if you'd like to, but it's 24/7. If you just need somebody to talk to, that's available.
All right, Dr. Kennedy, thank you so much for your time. You can contact baptisthealth.com for more information or give them a call by calling 1-888-BAPTIST.